great to have the room almost full and not have controversy bringing everybody out, right? We appreciate the fact that you're here. We have a number of announcements. Tammy Colon, who's the director of our Mental Health Board, is here to highlight the Mental Health and First Responders Week. Yep. Tammy, good morning.
Thanks, Mayor. In 2018, more police died by suicide than in the line of duty. The rate of PTSD and depression for police and firefighters is 5 times higher than the civilian population. And 20% of emergency management service providers have post-traumatic stress disorder. While many of us who experience life-changing events do so once in a lifetime, for emergency first responders, those experiences are weekly, daily, and for some hourly. So the Mental Health and Recovery Services Board staff and myself want to personally recognize and thank those first responders for their selfless commitment to our community and the significant impact they are having on the lives of the people in our community, particularly those suffering from the opioid epidemic. They give us, all of us and our loved ones, one more chance to try to work through the opiate addiction that are stealing the lives of our very valuable community members. We historically think of EMS as police and firefighters and nurses and EMS workers, but I'm proud to also acknowledge to you that there is a new group of individuals who have agreed to be on the front line, available 24/7 to respond to people who are being treated for opioid addiction in the emergency rooms or by responders. And that's a group of folks that we call the Quick Response Team. That team is made up of individuals who are in recovery from opioid addiction, who have pledged their lives now to reaching out and helping others in that most vulnerable moment to get into treatment. And they have partnershiped with all of the EMS folks in our communities and have agreed to respond at any minute in the community when they've come across somebody who is in need. And so they tirelessly and effortlessly get out of bed and they go and they try to engage and get individuals into treatment. So it is with great appreciation that we want to acknowledge our first responders this week. It started on Monday. It runs through next Monday. So if you're married to one, know one, live next to one, please, first of all, thank them, recognize that the work that they're doing, and also ask them how they're doing. Because knowing the person's baseline and then recognizing changes in their baseline will allow you to be more aware that something may be going on, and then we need to reach out and help them as well. And before I bring up some of those quick response team members and peers, individuals in recovery who have been saved by first responders, I find it ironic that it's also May is Mental Health Month. So we get 2 celebrations up here today. And so I just wanted to share with you what the mental health system is doing to try to work and help lift that load of our first responders. We are very active in providing critical incident stress management to our first responders. That is a service of a team of folks that are trained that go out. They work with firefighters, police officers, EMS. They work with agency providers who have experienced a tragedy. And the goal in going out as a team and helping them is to try to help them process that traumatic event so that it doesn't remain ruminating in their mind and they're less susceptible to having trauma long-term after the event. We also do crisis intervention training for our law enforcement and our first responders. We try to equip them with ways to manage people who they come into contact with who has an opiate addiction or a mental health disorder. And then we also know that stigma and access to treatment is important, not just for the folks getting the service, but for our first responders to have somewhere to send them. So we work very diligently in making sure that they have quick access into services so that they can feel at the end of that experience at least somebody may have an opportunity into treatment. So, Mayor, if it's okay with you, what I would like to do is ask some individuals who are very much personally appreciative of our first responders to come up and tell their story.
Sure.
Heather Rubel. Hello.
Good morning.
Good afternoon. My name is Heather Rubel. It is a great honor to be here today because 4 years ago this year, I was actually serving a 4-year sentence in Ohio Reformatory for women due to my opiate addiction and criminal activities that I did partake in years ago. But I get to celebrate today that I've been with Coleman Professional Services serving as a recovery coach for almost 3 years now. So the uniqueness of a recovery coach is we do have a lived experience. So we didn't live those years of addiction in vain, and now we're able to give back to our community and work hand in hand with those that I once was very intimidated by, that I had my own negative stigma of. I didn't want to be around police, EMTs, hospitals, anything, because I felt very ashamed and embarrassed of the things that I was doing and the person that I had become due to my addiction. Today it's a great honor because I shake hands with those folks. I work side by side with them, laugh with them, joke with them, and they see me today as a professional, which is an honor. So, and giving back to those that are just now getting into their recovery and seeing where it once was a huge part of my life that I was struggling to want to live. Now I get to help those that are in that same position and be a ray of hope for them and not give up. Give them that love and show them forgiveness and hope, and just walk the walk so they have hope for their future to be able to continue to do the next right thing and no longer be looked at as just an addict. This opiate epidemic has not taken just those that are less fortunate financially. It's taken any and everyone. It does not discriminate. So to be a face of recovery is a joy for me and an honor to also work with others that are just in recovery and being able to help coach them along and to just have joy to watch them as well be able to stand up before you today and speak and tell their story. So it is definitely my honor to now introduce you to Mr. Terry Green to share his story with you. Thank you.
I want to thank Mayor Berger for speaking today and thank Coleman's for bringing me this far, and God. I want to thank God that it can be done. It can be beat. I had 13 months in. Wasn't all done by myself. A lot of good friends, good help. I want to thank the responders that I have seen people die in front of me. I've seen people live in front of me. I just want to say thank you, responders. Thanks, Coleman's, and thank you. Thank you.
We do have a proclamation concerning whereas Ohio has the second highest rate of deaths due to drug overdoses in the nation. More than 4,800 deaths were attributed to drug overdoses in Ohio in 2017, which is up 1,081% from drug overdoses in 2000. And whereas the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin Counties is working to build a comprehensive system of prevention, education, intervention, treatment, and recovery for all citizens of our community. Whereas the City of Lima is committed to supporting efforts to prevent and treat addiction, including opioids, educate youth and adults about addiction and recovery, promote family building and workforce development as ways of combating the effects of addiction in communities, and encourage community engagement in efforts to address this present and growing opioid epidemic. And whereas the City of Lima and the Mental Health Recovery Services Board both express their deep gratitude and appreciation to all members in our community working on the front lines in the fight against this epidemic. Whereas law enforcement, emergency medical services, firefighters, emergency room staff, and treatment professionals who are bringing in help, hope, and care by working day in and day out to save lives, provide treatment, assist families, and support recovery in our community, and they should be recognized and applauded. Now, therefore, I, David J. Berger, Mayor of the City of Lima, do hereby proclaim Monday, April 29th through Friday, May 3rd, 2019, as Appreciation Week for first responders in our community, and urge all citizens to join in expressing their appreciation to all emergency responders in providing involved in providing care to those who are abusing drugs and creating health crises for themselves, their families, and loved ones. In witness whereof I have hereunto set my hand and caused to be affixed the seal of the City of Lima this day of May 2019. So, Tammy, to everyone involved, thank you.
Thank you very much.
Appreciate it. Well, thank you all. This was longer than we normally go, but we had lots of good news to share. So thank you for being here and appreciate your participation.